Hi everyone, my name is Stephanie Betker and welcome to my speaker series, Pulled Yet Prepared. I'm honored to be speaking to you today about what it means to be pulled as a nurse, as well as provide you with a few practical tips and tricks to be successful and manage all of the scaries that these situations bring. Before I begin, I want to acknowledge that I live, work, and play on Treaty 1 territory, the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and homeland of the Métis people. So I'm going to start by thanking Dr. Judy Boychuk-Ducher and the Nursing the Future team for this opportunity. A little bit about me. Well, I'm a registered nurse and an Instructor II at the University of Manitoba College of Nursing Program, and I just recently started there in February. My nursing journey started at the University of Saskatchewan, where I graduated with my Bachelor of Science in Nursing in 2016. I moved back home to Winnipeg, where I got my first job on an acute medicine unit, and after a few years, I became the educator for that same acute medicine unit. And in 2023, I graduated from the University of Manitoba Masters of Nursing Program, which provided me the opportunity to begin working at the U of M. And it's during my graduate degree where I focused my studies on early career nurses, their leadership development, and their transition to practice, where supporting early career nurses as they transition to practice and navigate situations like being pulled became a passion of mine. So being pulled as a nurse refers to the practice of temporarily reassigning a nurse from the regular unit to another area. And I went and I was reading these articles about being pulled, and I came across a variety of terminology used to basically describe the same thing. So being pulled can sound like pulled from a home ward to a new environment. It can be the reassignment of staff from one nursing unit to another. It can be floating nurses from their regular assignments to short-staffed areas, or it can even be temporarily redeploying nurses to another unit, or in some cases, to another facility, which we saw during that COVID-19 pandemic. But it didn't matter how it was being described. It's unfortunately a common occurrence. And these experiences elicit many emotions and fears when they happen. I personally have experienced being pulled many times, and I've experienced the roller coaster of emotion it brings. Nurses are required to be flexible and to quickly adapt to these situations that are outside of our control. Moving to unfamiliar areas can be stressful, and it's important to develop practical strategies to manage the scaries of being pulled. These strategies will be essential for your or my own success and for the safety of those that we care for. For me, I find it helpful to kind of understand the why behind being pulled. And so I went to the literature to help make sense of why organizations do this. I mean, we know that pulling nurses from their home units to unfamiliar areas creates staff dissatisfaction and reduces and negatively impacts staff retention. But we are working in a nursing shortage, as we know, and our patient populations have become increasingly complex and acute. It's this combination of a lack of human resources and an increase in hospital demands that creates challenges for organizations to navigate. Some of the whys that I came across were that short staffing requires creative solutions to meet the needs of each unit. And staffing shortages can occur due to illness, vacation, or vacancy. Resource management can be the use of pulling nurses to avoid mandatory overtime or overtime costs in general, and reduce the use of agency nurses. Short staffing leads to basic care not being done, which impacts our patients and our families. So to ensure that patient safety and patient safety and care needs are met, workloads need to be balanced across all units. And lastly, unforeseen fluctuating patient census allows for the movement of staff to meet unit needs. Some units, for example, might experience a surge in patient numbers, which require additional nursing support. And that's what we saw during the COVID-19 pandemic and often continue to see today. So being pulled is like navigating the unknown. You're in an unknown environment where you may not even know where the lunchroom is, the bathroom, the med room, the charting room, or supply room may be. You're working with unknown people, so the charge nurse, other staff nurses, ward or unit clerks, unit aides, the allied health team, and physicians may all be unfamiliar to you. You'll be caring for patient populations that you may not be familiar with, so certain patient tasks and procedures, patient diagnoses and assessments, and medications, they might all be new to you. There may be unknown processes on the unit you're pulled to, such as when to go for break and how long to go for, how to do a discharge or an admission. Maybe there's diagnostics or lab work that you've never done that you're going to have to navigate. And this is a long list of unknowns, and I'm sure I'm barely even scratching the surface. Reading this evokes anxiety, fear, stress, and frustration, even within myself. But it's being prepared for these situations that will ensure that we are equipped with the tools to successfully navigate these uncharted waters. So as I was preparing for this presentation, I started to reflect on my own experiences of being pulled. So here's a picture of me. And in this picture, I was actually pulled from my role as an educator to be charge of one of our acute medicine units during the COVID-19 pandemic. And you can see my goggles are just a little bit crooked. But by looking at this picture, I can feel, and I know that I was feeling frustrated, I was feeling anxious, and probably annoyed that I had been pulled. But I also knew that I was helping an area that very much needed me, and ultimately then was helping the patients and families on that unit. Now, this was not the first time I had been pulled, and it certainly was not the last time I was going to be pulled. So what did I learn during my experiences? Well, I'm going to share with you some of what I learned that has worked for me personally, and then woven in some of what I took from the literature, some of the research I did in preparation. All right, so being pulled to an unfamiliar area can make anybody feel like a fish out of water. But as a new nurse, the challenges faced with floating are compounded by lack of experience. As a new nurse, you're new to clinical practice, and the organizational policies and procedures may still be unfamiliar to you. If it is your turn to be pulled, it is important in these situations to start with yourself. So be self-aware. Be self-aware of your increased emotions, your anxiety, your fears, your stresses, whatever you're feeling. Take a minute to acknowledge them and develop some self-practices that will help you reduce them. This will be so important for you to remain focused and provide safe care. Remind yourself that being pulled isn't a reflection of your value to your home team or the work you do in your home environment. Be aware of your nonverbal cues. So relax those shoulders, your jaw, unfurrow your eyebrow because your patients will be picking up on these. Try to maintain a positive outlook on the situation. Remind yourself that being pulled is not permanent. Remember that the unit that you're going to help would be worse off without you, including the patients. And there's actually an opportunity to grow professionally during these experiences. Understand your skill set and competency. You have a right to refuse patients that are outside of your scope. So if there are tasks or procedures that you don't have the appropriate training for, communicate this, as there may be other tasks or patients that are within your scope that you can assist with. Take care of yourself. Go for your breaks, rest and recharge, and use this time to review any information that has come at you. Eat and stay hydrated. Use any stress management techniques to practice self-care, whether it be go to the bathroom to cry or deep breathing, going for a walk, or some positive self-talk. Whatever works for you, find time to do it. Resiliency in these situations is key. Being resilient is using personal protective factors to successfully navigate perceived stress and adversities. To develop resilience, nurses must engage in reflection to acknowledge their personal growth and help develop problem-solving skills. This type of self-reflective practice helps us learn what our own strategies are in stressful situations. Okay, so some tips and tricks. I always say go back to basic nursing ABCs or nursing 101. Remember basic patient care and refresh yourself on normal basic findings of the population that you're caring for. No matter what area you work in, basic nursing care doesn't change. And what do I mean by this? Feeding, washing, ambulating, turning. This type of basic care is often neglected during staffing shortages. Basic vital signs or medication administration crosses over many different areas and is important for patient safety. It's important to remember to remain patient focused and to try to set aside our emotions. Take the time to get a clear understanding of your patient assignment and responsibilities. Review your patient charts and understand their needs and care plans, and then you'll be able to prioritize your tasks on acuity and immediate needs. Engage in effective communication. Introduce yourself. Know the charge nurse and make sure the charge nurse knows you. What's your home unit and any other important information about you? Ask for help. Find an experienced nurse and buddy up to them. You want to find somebody that you're going to feel comfortable approaching, and having a familiar face will help make your experience more enjoyable. Ask questions if something does not make sense or if you are unclear. This does not reflect your ability as a nurse and is in fact crucial for patient safety. And finally, ask about any specific routines or protocols that may differ from what you're used to. Find resources and identify similarities. Using available resources such as quick reference guides and unit protocols will help ensure that you're providing quality care. And look for similarities between the care that you deliver in your home unit and the care that you're giving in the unit that you're pulled to. Ask for a tour of the unit to familiarize yourself with the layout. Where is the bathroom? Where is the med room, the supply room, the break room, etc., etc. Get a lay of the land before you start your shift. You may also think about asking for an orientation to an area in advance of being pulled. If your colleagues are frequently being pulled and your turn is coming, this may be beneficial. Familiarize yourself with the unit's documentation tools and remember the importance of thorough documentation. Take a moment to learn about the patient population that you're caring for. Research common procedures, as this will help make it easier when you encounter the procedure in the future. Look up any unfamiliar drugs or diagnoses, and think about creating a quick reference sheet that you can use at any time during patient care. When you're pulled, you're going to feel frazzled or flustered. So staying organized will help ease some of these nerves. Cluster your care. Keep a checklist or notes to keep track of tasks and patient care activities that you're responsible for. And ensure good documentation of all care and observations is done promptly. Have all of your necessary supplies. A stethoscope, a pen, highlighters, pen lights, etc., etc., so you don't waste time searching in an area that you're unfamiliar with. Understand the unit's emergency protocol. How do you call a code blue, and where are the emergency supplies located? Okay, so I know being pulled may seem daunting, and it often brings many negative emotions, and I too have struggled to see the silver lining when being pulled, but it is usually when I am reflecting that I'm able to see the positives. There's opportunity for professional growth. You have an opportunity to gain exposure to a different unit or specialty area that you may never have had the opportunity to try before. You get to experience a new patient population, and who knows, you might like it. You get to build on your knowledge and skills. Learning new procedures and protocols will increase your versatility and adaptability. The knowledge gained can be applied to diverse scenarios, which makes you a well-rounded nurse. You have an opportunity to increase your ability to be flexible and adaptable. You will improve your problem-solving and critical thinking skills in a new area, caring for a new population of patients. You will develop leadership, managing unfamiliar situations, and even being somebody who might guide and mentor those who might be floated to your unit builds leadership capacity. You will have improved communication skills because you will need to advocate for yourself and for your patients. There may even be some monetary benefits, like shift differentials or incentives when being pulled. And remember that doing something that terrifies you and kicking butt at it builds self-confidence and resilience. Successfully navigating these stressful situations reinforces our belief in our own ability. So, in summary, from what I want you to take away from this short presentation is remember that your emotions are okay and they are valid. Whatever you are feeling is normal, whether it be anxiety, fear, stress, nerves. Maybe it's excitement and adrenaline. Maybe you need to go cry it out in the bathroom. I know I have done this. It's important to feel and acknowledge these emotions, and they are not a reflection of your ability as a nurse. Remember your why. Why did you want to be a nurse? Why are you a nurse? Why did you come to work today? And use this to refocus yourself to these reasons to help remind us of the work that we're here to do and the patients that need our care. Be the nurse that you would want to encounter when you are being pulled. Be kind to others and be kind to yourself. A smile and a quick hello can go a long way. And reach out to a colleague, a manager, educator, a clinical resource nurse, even me if you need it. But find somebody that you can debrief with and confide in and share your concerns and experiences with, because talking helps us navigate these stressful situations. I think that's all I have to share, and I want to thank you so much for taking this opportunity and for taking the time to listen to me today. I hope you learned something, or you at least feel validated that you are not alone in these experiences. Thanks, and take care all.